and welcome to another episode of Coffee Break School Psychology, where we brew up fabulous ideas with fabulous guests, 10 to 20 minutes at a time. And I have my coffee, and it has actually already been consumed. Lynn, do you have your coffee? Are you
I,
prepared?
I- since I'm in a later time zone, I will stay away from the caffeine, but I have my water, so
All
it'll
right.
be a watered down coffee.
Dehydrate and rehydrate, representing in this Zoom. So I am super excited to present this guest to talk about something that was not an issue maybe 5, 10 years ago, and now is a huge issue, and that is the issue of vaping. So I'm going to let you introduce yourself.
Thank you, Rebecca. My name is Lynn Fiellin. I am trained as a physician researcher. I was up until about 2 years ago on the faculty at the Yale School of Medicine and am now on the faculty at Dartmouth College. And I started a lab about 16 years ago now, which is called Play to Prevent, where we develop video games as interventions targeting a range of health outcomes in young people, including mental health, including substance use. And a major focus of that substance use has been vaping. We have seen how that epidemic has emerged, which I'll talk a little bit more about. But our games have been used across the country, across the world, and we've been able to demonstrate through science that they've had real impact on changing the way kids think and the things that they do.
Thank you for that. And I would love to learn a little bit more about like how big of an issue this is. Like what is the prevalence of vaping in schools and maybe as a school psychologist myself, like there's a lot of discipline things that come out of it. Like maybe just like paint a picture for us. And there's educators out there listening and perhaps parents who are wondering like, was this big of a deal? Like how big of a deal is it? And how does it impact our kids at school? Can you kind of just set the stage for us?
Sure. So, vaping or electronic cigarettes were first introduced as a way to help adults stop smoking combustible cigarettes, which made a lot of sense because they did deliver or they do deliver nicotine, but they didn't theoretically deliver all the other possible carcinogens that we saw with combustible cigarettes. Unfortunately, what happened is these devices ended up getting marketed pretty strongly to young people with flavors, with new, Hello Kitty, you know, emblems on them. I mean, the companies really worked hard to make these incredibly attractive to kids, essentially getting a whole generation of young people addicted to electronic cigarettes or vapes as they became because of the high rates of nicotine in these devices. And so we've seen this epidemic go up and down. Juul was a big company that distributed vapes. Actually, was discontinued and has now had to pay out millions, probably close to billions of dollars in settlement funds for their role in creating Juul vapes that have, again, led to a lot of addiction in young people. Currently, if you look at the statistics around vaping in young people, we have seen a slight downward trend in the last year, which of course everyone jumps up and is hooray, hooray. However, I think we need to be really cautious about that. We're still seeing rates, of 8, 9% in middle school and high schoolers. So we're talking about hundreds of thousands of kids who are regularly using vapes. And that is a problem for a number of reasons. One thing is that, as I mentioned, the thought was that electronic cigarettes or vapes were a healthy alternative to combustible cigarettes. However, we now know that they do have a number of possible toxins in them, chemicals that are really bad for you. Interestingly, when we first started doing this work, um, looking at ways to intervene with young people around vaping, overwhelmingly kids told us that they just saw vapes as being flavored air, had
Mm.
no concept that there was any concerns of any harmful chemicals. And one of the most harmful chemicals is nicotine, which is probably the most addictive substance we have out there. And so, the health consequences in terms of some of those toxins, in terms of emerging addiction to nicotine, and then in schools, which is really where this epidemic has brought us in is hearing from numerous educators, school administrators about their daily struggle with their students vaping in school constantly. And that means that they are in the bathrooms vaping, they are not in the classroom, they are not doing what they should be doing in school, what they need to be doing in school. And so, many schools we've talked to have had to close all their bathrooms so that the kids
Wow.
don't go there. And so not only is it having health consequences, it's having huge consequences in terms of kids' academic experiences. And then a number of kids, and this is where this has continued to sort of involve us and where we've had to kind of morph to address this need, is kids getting suspended for vaping in schools. And we know that, probably better than I do, the huge implications of suspension in terms of impact on academics, on mental health, on future success, all of that. And so we've had a number of folks who come to us much more from a juvenile justice standpoint, educators and school administrators who say, we don't want to suspend half our eighth grade class for vaping. So we need some other alternative. So this has just kind of exploded into a major health, academic, juvenile justice issue, and is really problematic for everyone involved.
And I wonder, as you're talking, I'm thinking, when I think of vaping, I think of like, oh, middle and high schooler kids. Then I also, as a school psychologist, think about like prevention activities and how young are kids starting vaping?
Well, that's what's really frightening, is that hearing from schools and from some families about, their elementary school age kids, their 10-year-olds. And some cases it's because they have an older sibling
Mm.
who's already initiated. Sadly, we also see a number of parents involved with, you ask kids, where did they get their vapes? And they say, oh, my mom gave it to me. So there's sort of this intergenerational issue as well. So I think part of, what we've also been increasingly trying to focus on is families and parents in this, and a full sort of 360 approach to educating everybody about this, and the harms, and how you really need to get this under control, because otherwise kids are not going to go in the right direction.
So let's pretend you have the ear of every single parent. I mean, we got some good reach here at Coffee Break School Psychologist. Doesn't reach everyone, but let's pretend for a moment every parent is listening right now. Every teacher on the planet is listening right now, no matter what grade level they teach. Is there something that you would love them to know, like a misconception about vaping, or a, like, if you do this one thing, please do this thing? Is there anything that you can kind of share with the listening audience that you feel like is just one of the most powerful things that you teach out in the community?
So I think for any adult who works with or lives with or cares for young people, to recognize that, these devices have a lot of potential harms. Probably one of the most critical ones being their relationship with addiction, because really there's no other reason why a kid is going to be leaving their classroom constantly to go vape someplace else if they don't have a dire need, a physiologic need to do that. And so I think for parents, for educators to really understand the potential harms with these devices, and that, that they're, if kids are really exhibiting serious issues, be it that they're getting suspended from school, they're getting in trouble, their grades are failing. Another major issue that has evolved is this sort of reciprocal relationship with mental health issues. That kids who are really struggling with mental health issues are at much higher rates of starting to vape. And likewise, once they're vaping, that increases their mental health issues. So it's this vicious cycle. And so we're seeing very high rates of mental health problems in kids who are vaping and causing kids to vape. Um, and so to really try to pull it apart and have adults think about what is going on and what can they do to help. And if it really, it's the same thing, age old story of how do we get that family member to stop, to quit smoking. And this really isn't all that different. And so I think to be aware of all those harms, to be able to talk with your kids about them, be it your kids or your students, um, and to have resources on hand, which, we can share through this podcast to help them help their kids, because this is it's not a trivial issue. And we're seeing a whole generation of kids who are really, really struggling with this.
Yeah, I mean, I'm a school psychologist and I study mental health all day. I wake up every day thinking about kids' mental health, and I just am having a moment with myself. I'm like, I haven't even talked about vaping with my own kids. Like, it just hasn't hit my radar, right? Um,
No, and in big part because, again, one of our early studies, we focused on looking at what those messages were in the marketing campaigns. And this actually was work that was funded by the FDA, because the FDA was, again, becoming very aware of the fact that these companies were marketing to young kids. And that in and of itself, where they again have vapes that look like, hair barrettes, have vapes that are built into hoodies. It can also help but make parents think, oh, this is like a fun, cool thing that my kid's doing. Like, this can't be harmful because it's being marketed out there openly, to this entire population. So I was the same way originally. Before I started talking to kids and really seeing where the problem was, I just thought it was like, oh, a healthy alternative to smoking. And then it's just really become clear that it's just the opposite.
so I'm freaked out
Oh,
for every child in the schools. What do I do? I'm aware of the problem. I know that it's, been marketed to be safe and it's absolutely not safe, and kids are very probably sneaky about it. I mean, the hoodie thing, like I wouldn't have even thought of that. And so we know there's problems that kids are going to be like vaping in class or sneaking away the bathroom, and then it starts this trajectory towards unhealthy addictions. So, what are some resources for educators out there who either want to like get ahead of the challenge, or parents out there, or are in the weeds with this challenge already and be like, wow, this is a huge issue at my school? What resources do you recommend that folks access? And, both like things that they can personally do to upskill their awareness, but then also just like on a practical level. What are some like practical tips for folks listening?
yeah. So as far as resources, I mean, again, we've spent many years developing, specifically an evidence-based intervention in the form of a digital health game that targets both knowledge as well as attitudes, behaviors around vaping and smoking, but really increasingly about vaping. Have conducted rigorous science to demonstrate that this game works and has impact. And so this is a game that now a lot of teachers are using as kind of universal education and prevention with their students. And so I think, to be able to deliver what we found again over the past 16 years of my doing this work and this research, is that delivering this type of content in a form that young people love, that's a space they're in. They love playing video games. That's, they're, that's kind of part of the fabric of their environment. And so they're much more receptive to this content, and they really get engaged, and the information and the skill building really sticks. So I think, that is one example of a resource. And I think, the last whatever 10, 15 minutes of this discussion has really been a huge downer. And I don't mean it to be, because I think, there are so many positive things that one can do, besides sort of the approach of education and prevention. Another product we created really in response to hearing from educators who were so distressed about suspension rates was really creating something that could come much more from a restorative justice approach, that instead of being punitive and we're kicking you out of school or you're getting suspended, we're going to give you, content and sort of curriculum, if you will, that will help you understand what the problem is and help you, student, develop skills to change your behaviors. And so really coming from a much more positive, keeping them in school, giving them the skills and the information they need, so that they can make better choices. So I think, having resources available that follow the whole line from early prevention, to really more of a, again, kind of positive, restorative approach for kids who are already engaged in this. Because we know having, suspending kids doesn't help the problem. Now they're just vaping at home.
Mhm.
They really need to better understand. And a lot of this is just the perceived risk of harm of something like vaping. If you look at how people think of it in terms of the risks, they don't see it as being risky for the most part. So I think we need to be able to shift that mindset and get them to recognize really an accurate perception of risk of harm, because we know from science that generally if human beings think something is more risky or harmful, they're much less likely to do it. So that's a big part of what our interventions have focused on, is helping people develop an accurate perceived risk of harm so that they can then make their decisions based on actually what is, as opposed to what they think is.
Well, I'm glad we ended with something, some hope, some positivity, some resources. So let's say I'm a teacher or I'm a support staff member, and maybe it's not my role to like do a health ed curriculum on vaping, and but I want to help, um, or I want to learn more. Where can we direct people to learn more about, materials perhaps, or kind of resources or places to dive deeper? If you could share your website, that would be fantastic, because sometimes, you may not be like, well, I can't take on like vaping in my school, but like I want to help. This seems like a big issue, and now that I'm aware of it, I want to do something. So where can people start?
Right. And that's a really good point about sort of the capacity to address this, right? I mean, the school day is so compressed and there's so much that has to get done. And so one of the virtues of our games is that they really, as video games are, they're kind of standalone and they don't need a whole lot of adult involvement. Kids know how to play games, so they just jump right in. The difference with these games is they're what are called serious games, and that they deliver serious content, hopefully to help people. So our organization is called Playbl, which is spelled Playbl. It came out of the idea of playing to make kids more able, and with regards to a whole range of different health outcomes. But there you can find a whole bunch of information about our games, about the science behind our games, because it's typically really important to know that we've actually demonstrated that they work and change things for the positive in young people. Can contact us to talk more about the games. We have lots of professional development materials, user manuals, curriculum guidance, to really help, educators, again, do that heavy lifting around the content. And what we've heard from educators is what they love about that approach is that they don't have to focus on the content and the delivery of the content. They can focus on the relationships with their students. They can focus on having the really important discussions, kind of to debrief after kids have gotten this content. So, we would be happy to hear from anybody and talk through if it's more prevention education, we have content for that. If it's more, kids who are looking at suspension and really suffering and struggling, we have content for that. So kind of the whole range. We have a solution.
Well, I really appreciate your time. That's why I love nerding out on coffee break. School psychology is I always learn
Cheers.
something new. So cheers to you for coming on.
Thank you.
I really appreciate all the work you're doing for our young people out there and really grounding it in science and education. Because as school leaders, we don't just teach reading, writing, and math, we teach life skills. And so this is really something that, can be wonderful for our educators to know about. So thank you so much for your time. And everyone,
Thank
please go
you.
check out Playbl, and we will provide you resources, in the show notes and downloads, so that you guys can go to trusted sources to learn more about vaping prevention. Thanks so much, Lynn.
Thank you, Rebecca. Enjoyed it.